Hey y'all, my name is Jordan Rush and I'm going to be discussing the benefits of exercise on peripheral artery disease. Before we discuss the benefits, let's go over a few things. Peripheral artery disease is the partial or complete blockage of one or more peripheral arteries. This means there's an insufficient blood supply to the lower extremities, aka your legs. You're not getting enough blood. Peripheral artery disease occurs more in the elderly population. Older people do tend to have more cardiovascular diseases or problems, so this is not surprising. Also, there is no true correlation between obesity and peripheral artery disease. However, obesity causes several risk factors for peripheral artery disease. Now onto the benefits of exercise. Exercise is a great way to treat peripheral artery disease. Exercise therapy or exercise programs are normally recommended or prescribed to people with this disease. The most common type of exercise treatment for this disease is supervised treadmill walking. This means a medical professional will supervise a person walking on a treadmill for a certain amount of time. The goal of this is to increase the distance they can walk on a treadmill. A great alternative for this is home-based walking, meaning they do the same thing except they're at home and there's no medical professional supervising them. This would be for someone whose peripheral artery disease is not as severe as another person's. Exercise does reduce several risk factors for peripheral artery disease, including obesity and other cardiovascular diseases. Here are some more benefits of exercise. Exercise increases collateral blood flow. This means that the lower extremities see an increased amount of blood flow. Exercise also improves nitric oxide-dependent vasodilation. This is just a really big way of saying that blood pressure and blood flow are more efficiently regulated. Exercise improves mitochondrial energetics, aka your metabolism. The more you exercise, the more you burn calories, increasing your metabolism. Exercise decreases the amount of markers for systemic inflammation. All these benefits can be seen in people with peripheral artery disease when they exercise. Now let's look at some barriers to exercise a person with peripheral artery disease may face. First, there's a lack of insurance coverage for medically supervised exercise programs. Exercise programs are not typically used to treat diseases, so some health insurances may not cover them. A person's willingness to participate in exercise can be a barrier. One of the symptoms of peripheral artery disease is leg pain when exercising. If a person cannot push past the leg pain to exercise, then they're probably not going to exercise. The availability of exercise programs can also be a barrier. If the exercise programs are not offered, then that person cannot exercise. Also, time constraints, like not having enough time in the day to work out, can be a barrier to exercise.